The major performance domains for an athletic therapist. 1. Prevention. The domain of prevention encompasses a broad spectrum of knowledge and skills that address the risks associated with participation in sport and physical activity. Such risks range in severity from minor to potentially catastrophic injuries or illnesses. In a similar manner, the strategies used to minimize such risks can vary from relatively simple to complex. Examples of injury and illness prevention could involve pre-participation physical examinations, regular safety checks of equipment, facilities, and field areas, designing and implementing year-round conditioning programs to develop and maintain strength, flexibility, agility, and endurance, promoting proper lifting technique and safety in the weight room, following universal safety precautions to prevent the spread of infectious diseases, applying appropriate taping, wrappings, protective devices, or braces, as well as monitoring environmental conditions, such as temperature, humidity, or lightning during thunderstorms, and following guidelines for safe participation in adverse weather. 2. Clinical evaluation and diagnosis. The domain of clinical evaluation and diagnosis addresses the responsibilities of the athletic trainer in using standardized clinical practices to make decisions regarding the nature and severity of an injury or illness. Evaluation, or assessment, can involve several scenarios, including on-field, or on-site, primary assessment, off-field initial assessment, and follow-up assessment. In each situation, the evaluation must follow a systematic format that includes a history of the injury or illness, observation and inspection of the condition, palpation of soft tissues and bony structures, and a variety of tests, for example, range of motion, muscle strength, sensory and motor neurologic function, ligamentous or capsular integrity, and functional status. This information is essential in making determinations regarding the extent and seriousness of an injury or illness and, ultimately, in deciding the appropriate management of the condition. 3. Immediate care. The immediate care domain identifies the role of the athletic therapist subsequent to determining the nature and extent of an injury or illness. Regardless of the setting, the athletic therapist must be prepared to care for and prevent further harm in patients with a variety of conditions. As such, immediate care could range from the implementation of standard emergency care for a life-threatening condition, for example, activating the emergency medical plan, to rendering standard immediate care for a musculoskeletal injury, for example, immobilizing a possible fracture and applying cold and compression to a sprain or strain. 4. Treatment, rehabilitation, and reconditioning. The athletic therapist is responsible for the implementation of treatment, rehabilitation, and reconditioning programs appropriate to the diagnosis made during the evaluation and assessment phase. In consultation with a physician, the athletic therapist develops a comprehensive treatment program, including therapeutic goals and objectives, selection of appropriate therapeutic modalities and exercise, use of pharmacologic agents, methods to assess and document progress, and criteria for return to participation. Information gathered and documented during rehabilitation assists the physician in determining when the individual may be cleared for participation. 5. Organization and administration. The domain of organization and administration describes the responsibilities of the athletic therapist in developing and executing a series of plans, policies, and procedures to ensure responsive and efficient operation of the athletic training program. Some aspects of organization and administration will be similar regardless of the setting, but when developing policies and procedures, consideration must be given to issues specific to the particular environment. General areas that warrant attention in this domain include documentation and maintenance of the health care records, including those pertaining to health services, like pre-participation examinations, injury evaluations, immediate treatment of injuries, illnesses, rehabilitation progress, and medical clearance to participate. Other services rendered to an injured party, for example, counseling, educational programs, and referrals to specialists, confidentiality of medical records, financial, facility, and personnel management, purchase of equipment and supplies, equipment reconditioning records, compliance with defined safety standards, emergency care protocols, public relations, and normal operating procedures. 6. Professional responsibility. The domain of professional responsibility focuses on the expectations of the athletic trainer relative to adhering to ethical, legal, and other professional standards. The knowledge and skills identified in this area are intended to ensure appropriate care in all aspects of healthcare delivery, for example, patient assessment, care, and treatment, knowledge of current best practice, and administrative functions.